All right, etiologies. What the heck's an etiology? It's a cause of a disease. That's all it is. The cause of the disease. There's a lot of etiologies for diabetes and malaise and headaches and stuff. What's the cause of it? That's what this is. So here's a few things you need to worry about, or to know. Idiopathic. Idiopathic is not that you're an idiot. Idiopathic just means an unknown reason. We don't know why. Idiopathic. We don't know what's causing the non-disjunction in Down syndrome. Why it's not splitting properly. Right? It's idiopathic. Okay? You also have iatrogenic. Iatrogenic is due to a medical or surgical treatment. Okay? Or its effects. So a good example of this is here you as a nurse and you're taking care of a patient who's got cancer. You're giving the patient through IV, an IV line, you're giving that patient chemotherapy. And chemotherapy for cancer is literally poison. It's going to kill the cells in the tumor. So you could imagine the side effects of that if it goes to other things, right? It's going to kill the cells in your hair, so that's why you go bald. It goes to the stomach. It's going to make you feel nauseous and stuff. But if that nurse pulls out the IV and there's some chemotherapy left there and it starts to drip onto the skin, it will burn that skin and cause necrosis of the skin. Okay? I don't want to say a nurse, anybody can do with this. But what I'm saying, that's a iatrogenic reason for the necrosis. It's not because of the nurse, it's because of the treatment that we've been giving. Okay? Iatrogenic, even when I'm talking about losing your hair or making you nauseous, that's a iatrogenic reason. It's because of the treatment that that person's getting. Medical treatment or surgical treatment. We also have nosocomial. Nosocomial, basically, it shouldn't apply to any disease that's contracted by a patient while under medical care. All right? PT is patient. However, over the years, using this term, it's whittled down to just, quote-unquote, hospitals. So nosocomial means hospital-acquired. Okay? And more specifically, it really means hospital-acquired infections, particularly. All right? So any infection that you get within 48 hours of being admitted or 30 days after discharge from the hospital, because it could still be in a prodromal area, we call that as nosocomial infection. You got the infection, because everyone in the hospital is sick. It's very easy. If your immune system's down because you're sick in the hospital, it's easy to acquire a lot of this stuff. That's why it's important that when you see a patient, you wash your hands. Every room has a sink. Wash your hands, do whatever you need to do, and then when you leave, you wash your hands again. So you don't pass those germs to other people. Germs, infection. But that's what you do, all right? Think of the stethoscope. I always carried a pack of rubbing alcohol swabs, right? The little thing. And every time I listen to someone, I take the stethoscope and I wipe it down. Because think of how much germs is. How many are on that that stethoscope when you pass it from one person to another? Okay, so it's little things like that. All right, and about 5 to 15% of all hospital patients acquire these nosocomial infections. Okay? Just showing you over here that a third of all these nosocomial infections are urinary tract infections. Okay, and the other ones, the other 2/3 are a mixture of this stuff. Okay. Disease terminology, these are pretty quick about these things, just kind of bullets. We basically have an acute disease is a rapid onset. A chronic one is something that's taking on a longer amount of time, maybe days to months or weeks. Remission is a period when signs and symptoms are getting less, right? Exasperation is periods when the signs and symptoms are getting worse. Complication is an onset of an additional disease when you already have a disease, and sequelae is events that result from disease or trauma. Okay, so just bullet kind of stuff. All right, probably won't ask you questions about this stuff, but in the questions that I have, I'll be using those terms, and if you don't know what those words mean, you're going to get the answers. You can't come up and say, Dr. Gamaro, with the test and say, what is this aspirate? You need to know what that is. Right? Speak the language. Etiologies. Hey, vindicate me. Every once in a while, you're going to get some good mnemonics. Vindicate me. This is something where if someone asks you, what are the causes of this disease? Here's a person who's got, vomiting up blood. So you got to think with that sign or that symptom, vomiting up blood, what is the cause of vomiting up blood? There could be a whole slew of different things. This is where it's going to come in. You've got to get yourself organized. If you're taking pathophysiology, you're going into a medical career, you've got to get yourself organized. It'll take me longer to explain this stuff, but in your head, you should go in your head, okay, he's asking me the indications or the causes of vomiting of blood. So if you know this, is it a vascular reason? Is it an inflammation reason? Neoplastic, which means new tissue. Is it cancer? Is it degenerative, or is it caused by medication that the person's taking? Is it caused by an infection? Congenital reason. Is there something there that he was born with? Is it because of an autoimmune disease or an allergy? Trauma. Someone punch him? Right? Endocrine. Is it a hormonal reason? There's hormones that come out of the stomach. Is there something going on there? Is it a metabolic reason? Or is it emotional, psychiatric? Maybe it's not what you're eating, but what's eating you. Right? So these are things that you put together. So let me go through a little bit more detail about each one so it gives you an idea. All right? So vascular could be ischemia, a decrease of blood flow to an area, or infarction. You're going to have an area where there's no blood supply there, which means the tissue's going to die. So you could have angina, myocardial infarction, stroke. These are good examples of this. Okay? You could have inflammation. All right? The body's response to harmful stimuli. That's what chapter 2 was all about. We talked all about inflammation on that. Keep this in mind. An inflammation does not mean infection. An infection does not mean inflammation. An infection may cause an inflammation, but not all inflammations are caused by an infection. Okay? So that's what's going on with this, right? That's what I just said over here. Inflammatory bowel disease, asthma, acne, arthritis. All right? If it ends with ITIS, it means there's an inflammation. It doesn't mean it's an infection. It means there's an inflammation going on. Like that. A wonderful ingrown toenail, right? That's an infection that led to inflammation. Okay? Neoplasia just means new tissue. Does not mean cancer. Although cancer falls in this category. A wart is new tissue that's growing on your skin, right? So that falls in neoplasia. Degenerative, you start wearing and tearing things like your knee joints, right? You're going to wear and tear the cartilage in there. Now you got bone to bone, and now that's going to be degenerative. It starts breaking down. Okay, so that's osteoarthritis. Certain medications. Maybe that's the reason why that person's going through whatever that sign or symptom is. Certain medications. That's why you need to know side effects. Okay. Don't just memorize side effects. Understand why do you get the side effects if you understand the mechanism. This course is not geared towards pharmacology. We'll touch on things, like we'll talk about prostaglandins, and we did that with chapter 2. Prostaglandins and how prostaglandins are formed and what prostaglandins do. But you also need to know, like, aspirin and corticosteroids and NSAIDs, where are they going to block? And if you understand where they block the synthesis of prostaglandins, then you're going to know what the symptoms are and the signs of aspirin and whatnot. Okay? So Here's someone with gingival hyperplasia. This is very common in people with taking Dilantin for seizure disorders. So it's not uncommon to see this buildup of gums over here. All right? Now, granted, people can just have this just because that's them, you know? But all of a sudden, if you start seeing this and they've been taking Dilantin for, let's say, 3 years, then you have a reason for this, you know? You can put that together. Maybe the patient is concerned. I'm getting like this. I want to see the dentist. That's why dentists need to know what medications you're on. Maybe that's the reason why. Okay? Infection, right? Colonization of pathogens. We'll talk all about that in another chapter. Opportunistic pathogen. This is where you have bacteria all over your skin, all over your parts of your body. And there's certain parts of your body that don't have anything, we call it sterile. But there's places, like in the vagina, there's places that have, we have candida there, which is a yeast. And it sits there. But we have bacteria that actually keep that yeast down. The two of them kind of work together to keep the vagina at a certain pH, is what you want. But if that bacteria starts deteriorating, and you start taking, you start douching a lot, and it's going to kill the good bacteria, if you're taking a lot of antibiotics, and it's going to kill the good bacteria, then that leaves the yeast to grow more. Because the bacteria was keeping it down, keeping the yeast down. So now the yeast have the opportunity now that before they weren't causing any disease, but now they grow even more. They have the opportunity to grow more and cause some sort of disease. In this case, a yeast infection. Okay, does that make sense? So you do need to know what opportunistic pathogen is, okay, or an opportunistic infection. When your immune cysts flora and they start causing other things that weren't causing any problems, what we call normal flora, and they start causing problems. Okay? And there are things like MRSA, which is methicillin-resistant Staph aureus, polio, ringworm, malaria, HIV, shingles. All of this will lead to opportunistic pathogens. Okay? Congenital, all right? Present or before birth, all right? Could be hereditary, all right? Infections being passed down to the placenta or through the placenta. Certain maternal drugs can be passed down to the fetus also and cause certain issues. We can have something like alcohol, right? Back in the 50s and 60s, drink all the alcohol you want. You got pain when you're in labor, drink the alcohol. When, you know, the 1800s, that's what they did. But now they realize drinking alcohol causes fetal retardation, okay? Decrease in mental capacity. So it's not good to do this. So alcohol is what we call teratogenic. Alcohol is the teratogen that when a pregnant woman drinks it, it goes to the baby and it causes some sort of disturbance with the growth or the development of the fetus. Okay? So that's what that is. A teratogen is doing that. Okay? And cerebral palsy, cleft palate, Down syndrome is all this congenital stuff. Okay? Any of you know about thalidomide? Who here has heard of thalidomide? Yeah, a few of you. Thalidomide is a drug that was given to pregnant women during the 50s and 60s that was to decrease morning sickness. So it sounded all fine. Yeah, just take this medication, you don't have the morning sickness. The problem is 8% of the babies started having limb deformities. So now and unfortunately, they even were tagged with even the name of dolphin syndrome because of the way that the limbs look. I don't agree with it, but that's what they called it on there. So that's what's happening. You have these things over here. So they don't use thalidomide. They use thalidomide, but they make sure that the patient is not pregnant. They use it for other things. Okay? And that's what happens with that. Okay? So thalidomide is a teratogen. You also have allergies or an allergic reason or etiology. and that's going to increase the sensitivity to a certain foreign antigen, right? Hives, poison ivy, hay fever, okay? Autoimmune. We don't know why this happens, but your body develops antibodies to attack its own self. Not good, okay? Lupus is in that category. Graves' disease, multiple sclerosis. Multiple sclerosis that you build antibodies and it actually will attack the myelin on your nervous system, on your neurons, and starts eating away at it. So now those neurons are not going to function properly, and now you get weak, you can't see right, all those things, wherever they're going. So autoimmune diseases is that your body is making antibodies to attack itself. Why? We don't know. We'll get into those much later. Or it could be a traumatic reason for whatever that cause is. Trauma. It's the #1 cause of death in the United States for people under 35. These are motor vehicle accidents, MVAs. Go to emergency room, oh, we got 2 MVAs coming, right? IV drug use. That's the one you're seeing big on, right? That's the thing that's making all the news and stuff. That's growing, okay? It's also the #1 cause of death, or the 4th #1 cause of death in the United States overall, and like I said, is increasing, okay? That's also burns, gunshots, electricity, poisons, drowning, all that kind of stuff. Okay? Endocrine reason, all right, hormonal, diabetes, premature ovarian failure, right, a hormonal reason. Or metabolic, right, some kind of nutritional imbalance. Maybe he's getting infections because he's not eating enough proteins, because antibodies are made of proteins. So if you don't have proteins, you can't make antibodies, which means that you're going to have more infections. You've got to go step by step like telling a story, right? So obesity, cachexia, iron deficiency, PKU, and so forth. We'll get into those diseases as we go along. An emotional reason. Maybe they have some kind of mental or psychiatric disease, or some kind of chemical imbalance in the brain. Schizophrenia, depression, suicidal. Okay? So those are the different etiologies. So if someone has, let's say, coughing up blood, hemoptysis, think of reasons that would be causing that. Is there a vascular reason? Let me think of that. Yeah, it could be. There could be this, and so. So you're going into your head about different reasons why this person has these things. Some of them overlap with each other, of course. Okay? There could be a few different reasons for this, but this will help you for your differential diagnosis. I always said this in A&P 1. Physiology always reflects anatomy. Always, always, always. Meaning function always reflects structure. There's a reason why we have, on all our skin, we have 4 layers of the epidermis. But on the palms of my hands and the soles of my feet, I have 5 layers. That's the structure. So why would I have an extra layer of in the epidermis, in the palms of my hands and soles of my feet? Why? Protection. Those are the areas that are going to be more traumatized, or more prone of trauma. I pick up a hot pot of tea. If I pick it up with my palm, I can hold it a little bit longer than me touching on the back of my hand, right? So our bodies have adapted to that. Soles of our feet. When we were cavemen, we walked barefooted, all the rocks and stones. So we've developed and been able to adapt to that with extra layers of it. We got nails, hard areas, because those are the areas that are going to cause damage, right? You stub your toe and stuff. So you want hard areas where there's going to be trauma. Function always reflects structure. Physiology always reflects anatomy. The reason why something works is because of the way it's structured. So that's what's happening with this. So you could understand why the body's working this way if a disease is happening in this particular part. Right? You can understand why you have high blood pressure if your sodium goes up. Right? So if you understand pathophysiology, you really don't have to memorize everything. The signs and symptoms will make sense. Right? You now understand that if someone has high blood pressure, don't give them a lot, they shouldn't be eating a lot of sodium. I mean, we all know that, but now after I did that little scenario, you understand why. If sodium goes into the bloodstream, water is going to go into the bloodstream and follow, which means the blood pressure is going to go even higher. You got to put this all together. All right? So the signs and symptoms will make sense if you know the foundation.